Hello everyone. Let us see about cerebral palsy. What is cerebral palsy? Cerebral palsy is a congenital disorder affecting movement, muscle tone or posture. Again, what is congenital disorder? It is present from birth. Disorder means illness or sickness, ailment. So, cerebral palsy is a congenital disorder that affects the movement, muscle tone and posture. What is muscle tone? The tension, the amount of tension, muscle tension. In another way, we can define the cerebral palsy. This is a group of disorders that affects a person's ability to move and maintain balance and posture. So what is cerebral palsy? That is a congenital disorder that is affecting the person's movement, muscle tone and posture, then balance. Next one, the causes. What are the causes of cerebral palsy? Causes means reasons. What are the reasons? Cerebral palsy is caused by abnormal development of the brain. So that is occurring before birth. That is caused by the abnormal development of the brain or damage to the developing brain. Then what are the symptoms, common symptoms? First one, that is affecting the movement and coordination. So there is stiffness of muscles, stiff muscles and exaggerated reflexes. Second one, variations in muscle tone. Sometimes there is too stiff muscle or there is too fluffy muscle. Fluffy, again too soft muscles. Then rigidity, ataxia. What is ataxia? Impaired coordination, lack of balance. So in the patient, the people with cerebral palsy, they will have lack of balance or lack of muscle coordination. Then they will have tremors, abnormal movement, jerky movements that cannot be controlled. So what is tremor? The jerky movement and the movements cannot be controlled. Then slow writing movements. They are very slow in writing. So they will have writing problems. Then they will have trouble in walking, trouble with fine motor skills. Example, they will have problem with buttoning clothes or picking up utensils. Then they will show the problems with speech and eating, delays in speech, delays in speech development. They are having the trouble in speaking, sucking, swallowing, then eating and swallowing. They may have drooling also. What is drooling? Saliva flows out of mouth. Third one, development. The problems with development. Delays in reaching the milestones or motor skills. Examples, there are delaying in crawling, sitting, standing, walking. Then they will show learning and intellectual disabilities. Learning problems and intellectual problems. Then they will show delayed growth. Other symptoms: seizures, epilepsy, fits, then trouble in hearing, vision. Then they will have pain to touch, feeling, trouble feeling. They are having the problem with sensations. Next one, bladder and bowel problems. Example, constipation and urinary incontinence. Again, what is incontinence? Lack of bladder control. Then sometimes they may have mental health problems, mental health conditions. Examples, emotional conditions or emotional problems, or behavioral problems, behavior issues. Next, what are the types of cerebral palsy? There are many types. First one, spastic or hypertonic, athetoid or dyskinetic, hypotonic, spastic, athetoid, spastic or hypertonic, athetoid, hypotonic, ataxic, mixed. Let us see one by one. What is spastic? Hypertonic, the muscle, increased muscle tone. Hypertonic means increased muscle tone. The amount of muscle pressure is increased. This is the most common type of cerebral palsy. So the people with this spastic type, they will have the problem contractures. What is contracture, or what are the contractures? Permanently tighten muscles or joint. The muscles and joints are tightened. Permanently they are tightened. Then difficulty in crawling, walking. Muscles are stiff in one or more parts of the body. They have stiff muscles in one or more parts of the body. Second type, athetoid. This one is non-spastic or dyskinetic, and other name is dyskinetic, non-spastic. So there is no hypertonic. But sometimes they will have the problems. They will have the combination of the both hypotonia and hypotonia and hypertonia. What is hypotonia? Decreased muscle tension. What is hypertonia? Increased muscle tension. They may have the both, the combination of hypotonia as well as hypertonia. Hypertonia, stiffen muscle. Hypotonia, loosen muscle. Once again I explain. The people with athetoid cerebral palsy, they may have the problem both, combination of hypotonia muscle, hypotonia and hypertonia. Hypotonia, loosen muscle, decreased muscle tension. Hypertonia, stiffen muscle, increased muscle tension. So this causes muscle tone to fluctuate. Again, they may have feeding problem. Fluffiness. That means loose or soft muscles in the limbs. Problems with posture. Then stiff or rigid body. Fourth one, ataxic type. Ataxic. What is ataxic? Impaired coordination. impaired coordination of muscle. So poor coordination.